what is postpartum psychosis? That, I guess, that is number one. And where I'm going to go to look up this information is somewhere called USMLE, because I genuinely think this is the best place to find information for aspiring doctors, mostly. Let's look at med bullets. So usually these sorts of things, they give you like a snapshot, right? Like they give you a clinical picture of the subject matter. Oh my God, I don't want to log in. Stop. I'm not going to log in. All right. 25-year-old woman comes to the clinic 3 days after delivering her newborn son. She experiences the following situation. 3 separate vignettes are presented. Occasional tearfulness, feeling sad several days of the week. So that's like more than 3 days of the week. Still takes good care of her baby, has no thought of hurting the baby. Loss of pleasure, severely depressed mood most days of the week. She takes care of the baby, but sometimes has thoughts of hurting the baby. And is hearing voices telling her to drown the baby so that the world will be safe. And so you can kind of see the delineation of, I guess, symptoms and how the severity kind of progresses, right? Like, okay, so if you got a mom and she's tearful, she's sad, but otherwise no problems, they call this postpartum blues. If she's really depressed, a lot of the times, and maybe has thoughts of hurting the baby, that's postpartum depression. And then once you get into hearing voices, usually along the lines of like, you got to do this, otherwise something bad's going to happen, then we're now bordering into psychosis, and that's postpartum psychosis. So all of these are mood disorders. But these are the 3 major ones, and look at the incidence of this. Most people, 85% postpartum women have postpartum blues. That's a lot. That's a lot. Even fewer have postpartum depression, 15% at worst. But postpartum psychosis is 0.2%. That is low. That means it is a rare thing. Postpartum psychosis is very, very rare. I think another baseline to have here is, what is psychosis? Like, what is the incidence of psychosis itself? So like, far removed from the postpartum timeline, how often do people have psychosis? Let's take a look. So we'll look at the incidence of psychosis. New cases develop in the general population at, looks like a rate of 0.1%. Right. Schizophrenia, lower annual incidence, about 15 per 100,000. So very low, right? With a lifetime prevalence of 1 to 3%. Okay. Peak onset, mid-20s, adolescents to mid-20s. Males at a higher risk. So obviously there is a higher incidence in postpartum. For whatever reason, hormones, maybe it's the stress of having a kid. Somehow this causes a higher incidence of psychosis. So, but still pretty dang rare, right, guys? Like, this is still pretty rare by the looks of it. You got a dirty Dr. Pepper, let's go. Risk factors, history of premenstrual mood changes. So having had postpartum blues, being depressed while you're, before you're even pregnant, family history, and then just having a stressful life. So by the sound of it, looking at our popular patient, in this case, our public eye patient, Lindsay Clancy. It sounds like she maybe had a lot of these already kind of going for her. I'm not sure about her previous history, but it sounds like she had a stressful life. I don't know if her family history has anything indicative, and I don't know if she was depressed prior to that, but sounds like she might have had postpartum blues or depression and probably some stress. So, rapid onset. Like, let's actually look at how this turns on, right? Like, so when it happens, does it happen gradually? Does it happen immediately? It's fast. It happens like at the drop of a hat. So, kind of coincides with the timeline of events to a larger extent, right? It's like suddenly one day she just told husband, hey, go away, and then proceeds to do some horrific things, saying she's hearing voices. So that kind of coincides with it, right? Accompanied by manic or depressed mood. That I don't know. That I don't know. If was she depressed? Was she manic at the time? I don't know. Treatment lifestyle. No treatment required for postpartum blues. I imagine psychosis probably requires like psychoactive medications to a larger extent. So obviously I'm not going to log in and I don't really care about all this stuff. But yeah, obviously if you have psychosis, you're going to be hospitalized. There's, a chance that maybe they do ECT, antipsychotic meds, like all sorts of stuff that they would traditionally do for someone that is actively having psychotic thoughts. So, okay, we now have a pretty solid picture of what postpartum psychosis looks like, how fast it happens, and how often it happens to mom. So let's look at Lindsay Clancy. I don't know what, like, usually people don't put this information out, right? Maybe we talk to an AI about it and say, okay, what does it say? So she was a maternity nurse. Okay. So sounds like a pretty stressful life, right? Nurses have an extremely stressful life. Callan was 8 months. So, okay, does that coincide? How, like, obviously as you progress out of the postpartum period, like the incidence probably of psychosis goes down. So what we didn't understand here is how long the postpartum period lasts. So what is the postpartum period of time? 6 weeks. Immediately after a baby is born, typically lasts for like 6 weeks. Okay. Callum was 8 months. So, okay. Delayed. Okay, so there's some cases of delayed postpartum, recovery can last for 6 months to a full year. So I think it's safe to say, even though it's a rare condition, it's a rare condition, it can last up to a year, right? It can last up to a year. So I like I said, I'm looking at the data. I'm saying it can last up to a year in some cases, right? It's most likely going to be a very short period of time. But the postpartum period, what is it defined by, right? Like, what is it defined by? I guess that's what I don't know. What is it defined by? So it's a delayed phase. Gradual tissue returning to pre-pregnancy state. Okay. So it sounds like your hormones and your physical body largely go back to normal in that delayed phase. Let's look at another thing. When does postpartum psychosis, I guess, when does it stop, right? Obviously, there's a window of time where you're the most, whatever, at risk for it. But then at what point does that go away? Now, remember, there's a lot of other things you guys are mentioning, bipolar disorder, like other psychiatric issues. We'll take a look at those. I think we got to look at it one thing at a time. Otherwise, we start to get confused. I confuse myself if I start to consider one thing before another. So I'm trying to look at purely from a postpartum psychosis point of view, like when does it stop? Stop being a risk. So it begins very early, first 2 weeks, within the first 4 weeks after delivery. After the first month, the risk of first-time episode drops sharply, rarely considered a risk after first 3 months. Peak risk window. So probably within 3 months is it the most risky. So can this be considered postpartum psychosis? And I don't care. Like for now, I just have blinders and I'm looking at purely from a postpartum psychosis like picture, right? Would anyone here in the chat say this is postpartum psychosis? Would it be postpartum would you define this as postpartum psychosis? I'm trying to hear what you guys think first, and then I'll tell you what I think. Purely based on what we know from just the medical standpoint, the risk factors, all that sort of stuff. So, yes, here's the question, right? When did these symptoms first start? Right? Like that is the most important question. Exactly. Carry on. That's, I think, the most important piece of information. When did the symptoms start? Because obviously it didn't get to the point where she has a psychotic episode and then it manifests itself, right? Like, exactly. Like, did it happen with her first pregnancy? Did it happen with the second, the third? Because it can certainly become then a risk factor to get worse, right? Like after every time you have it. In the previous, the very first thing we looked at was the risk factors, right? Where did they go? Aha. So the history of this happening then increases. It causes a greater risk of it happening again and getting worse. Right? It gets worse. So did she, and I don't know if it's even going to give us this information or not, but did Lindsay Clancy report psychosis in her previous pregnancies? I don't know. I might just ask AI to scrub and tell me. No. Lindsay Clancy did not report experiencing postpartum psychosis during her previous pregnancies. First two pregnancies, no medical records or trial testimonies indicating suffering from postpartum depression or psychosis. Third, her mental decline began in the months following her third pregnancy. She began reporting anxiety, depression, and dissociation. The onset would have been December 2022, January 2023, and by October, so it's within, she started maybe experiencing this pretty quickly, right? Like she's saying she was having it pretty quickly. At least according to this. Let's take a look at what the actual source says. Well, that's great. Was prescribed more than 30 medications to treat her symptoms in the months leading up to her children's demise. According to her legal team, including SSRIs, antipsychotics, and sedatives, her defenses argued that Clancy was overmedicated and that her healthcare providers did not communicate with one another or compare notes. Clancy's mother, Paula, testified at trial that her daughter's treatment had made her increasingly paranoid and that Clancy believed the medication were destroying her mind. That's interesting, right? That's kind of interesting. Obviously this is 19thnews.org. I don't know if this is a reputable what is the source or not. But all we can look at, you guys can say it's wrong. I probably is. It could be wrong. I'm not sure. Let's just say it's between somewhere here and the truth. That's all we can really say, right? I think there's going to be, I know there's going to be bias. I know there's going to be incorrect information. That's probably always going to be the case, right? Something's going to be wrong. But what part of this has truth to it, right? I think that's what we have to take away from this. So what we could probably take away from this is that she's seen some doctors, right? And they have tried something. They have tried several things, between something and a lot of things. And is it true that she said that she was paranoid that the treatments were destroying her mind? Maybe. So, that's a lot of this stuff. Did she have, okay, you guys are asking, did she have bipolar? I guess we can look at that too. Did she have a prior diagnosis of bipolar or other behavioral health issues? No. Did not have a prior diagnosis according to, I guess, CNN. All right, CNN. Insanity defense. Bipolar. So Ziesel and Resnick both testified Clancy had bipolar and experienced postpartum psychosis. She was unable to conform her behaviors to the rule of law. She had no appreciation for the wrongfulness of her act. So I don't, where does this, so who are these guys? They testified that she had it? But where does it say that she, I guess, did they provide the evidence for it? So AI is saying no, but why is it saying no? If it sounds like they testified that she had it, but The defense's stance, her defense attorney argued she had underlying bipolar unrecognized by the doctors. I see. Okay. So it just wasn't diagnosed, right? Like that's, it wasn't diagnosed prior to that because they're saying it was missed. Which I can understand happening, right? That can certainly go. That can certainly happen, right? That it gets missed. So the claim treating her with 13 antidepressants. So that's 13 antidepressants. But they don't mention here antipsychotic or anything else, I guess. That would worsen. Being treated with an SSRI certainly can worsen bipolar, right? And sometimes you don't know as a doctor if you're prescribing, let's say, a new patient, and you don't screen for mania, and you just prescribe an SSRI, then you make the mania worse considerably. So drastically worsen the hidden bipolar condition, leading to psychosis. It was only after forensic psychiatrist formally diagnosed her. So then she was diagnosed, it sounds like, with bipolar, with postpartum onset. A psychiatric nurse practitioner noted that Clancy exhibited symptoms, insomnia, racing thoughts, but didn't hit a diagnostic criteria at the time. Showed that her husband initially pushed back against the possible diagnosis during a meeting. What? So wait, the husband is saying, like, wait, she doesn't have it? That's kind of crazy. Forensic psychiatrists for the state argued during the trial that Clancy suffered from a severe, prolonged major depressive episode with anxiety. They testified that there was no documented medical evidence of mania or hypomania. Well, that wouldn't make sense, because if this is true, right? These are literal manic manifestations, like racing thoughts and stuff like that. That is 100% but like bipolar symptoms. Like that's there, obviously. They testified that there's no documented medical evidence. If you want to look closer at the trial details, sure, just give us everything. The list includes, but is this not definitive? Was prescribed a rotation, 13 psychiatric medications. And I wish it would tell us the timeline, right? Like, I wish it would say, like, hey, this was tested on this month, or it was tested at this time. Because, look, man, you could just give us all these medications, but in reality, a short time frame, it's meaningless, right? This is kind of ridiculous if it is. This is even more ridiculous if it is a short time frame from a medical practice standpoint. None of these work in a short period of time. Zoloft takes a long time to actually work. So this also doesn't tell us why they tried all these, right? Like, why was this stopped and this started? Why was this stopped and this started? Were they stopped? You know, like, what? All of this is not good. Like this, it's a bad thing that she's on all these. If she was on all of them at the same time, that's crazy. That shouldn't happen either. That's dangerous. As a matter of fact, you can't be on all these medications at the same time. Why would you be on Zoloft and Seroquel at the same time? Unless it's like a very unique, maybe there's like a unique situation. Like this is antipsychotic, this is anti-suppress or depressive, but then like you're running up a risk of the SSRI, like serotonin syndrome. Like the risk of serotonin syndrome, it goes way up. Way up. Did she ever experience serotonin syndrome? Yeah. Became a massive talking point among observers due to her prescribed multiple serotonin altering medications simultaneously. It was not diagnosed in court. Okay. So they focused on, I guess, just their individual problems. Please tell me what medications she was on simultaneously at what point in time. So she was first on Zoloft. And then Zoloft Ativan, sure, that's fine for insomnia. So far, all of this tracks, right? Like this is so far, I guess, reasonable. Here we go. Prozac. So it looks like they switched to Prozac. Ativan, still hydroxyzine, trazodone. Okay, so this stuff will 100% cause you to dissociate. Zoloft was discontinued due to reporting of feeling numb. So they switched it due to a side effect. Panic and racing thoughts, overlapping doses of Ativan hydroxyzine, following an ER visit for severe sleeplessness. High-dose trazodone was added to nighttime routine. She begged to stop Prozac due to increased agitation. Okay. Simultaneous Remeron, Seroquel, Klonopin, and God damn, dude. If this is real, like that is crazy amount of drugs. Like, okay, this was described by the defense as her heaviest period of chemical overlap. Her husband remarked to doctors that they were turning her into a zombie. To stabilize her mood, she was on Remeron alongside Seroquel. And I think this is like an older antidepressive to stabilize her mood, alternating between heavy benzos. Yeah. These are I've actually never seen that before. Okay. Simultaneous medication, Seroquel and benzos discontinued January 3rd. Let's see. Upon admitting herself to McLean Hospital, doctors evaluated her heavy sedation and ordered her to completely step off Seroquel and all benzodiazepines to clear her system. She was discharged January 5th. And then she was put on amitriptyline, Valium, trazodone. After leaving McLean, her psychiatrist started her on a different class, amitriptyline. Looks like they titrated her up, concurrently used low-dose Valium. That's also, okay, sure. For daytime panic attacks and trazodone for sleep. So, a major point of contention at trial was how many of these simultaneous pills Clancy actually swallowed. Okay. While the defense argued this timeline proved severe polypharmacy, state investigators testified when they searched her home, containing the vast majority of the pills intact, arguing she frequently abandoned her medication regimens within days of starting them. So they're saying that she just wasn't taking them or something. God, this is messy, bro. This is messy. And just because she has a lot of pill bottles doesn't mean she... Look, I took lithium for the longest time. I had bottles and bottles and bottles of lithium. So it doesn't necessarily mean she's not taking them. I don't know. Like that, I don't think that's a valid argument. Right? Or did she just not take them? Like, did she say, like, no, I didn't take these? I don't know. Oh yeah, psychiatric medications are very crazy. Right. Yeah, you could have depending on how the doctor writes it, right? They can say start taking this and then like you're going to be on a higher dose. Exactly. Yeah, that what you're saying, Christiel, is something that has happened to me, and it actually happens very often. That a doctor will give you a way to take the medication, but actually overprescribe the medication. So you may have tons of extra medication, but it's just a result of the way the doctor wants you to take it, not by virtue of the pharmacy pill bottle. Like you take it as prescribed, right? There's a difference. So yes, absolutely the prosecution can unfortunately twist that fact, right? Like it can certainly be used against you. And I think by letter of the law, like, what do you do? Do you do what the doctor says, or do you do what the pharmacy says? Right? Those are often at odds in cases like this in medical practice. Because the doctor says, no, I want you to take the medication like this, but I'm going to prescribe it like this. So, regardless of how she was taking her medications, the only thing that can really, I guess, save her in this case is the doctor's notes, right? Like the doctor should have documentation saying, like, I prescribed this, but I instructed to take this or take it like this, and so the prosecution, even though they say, oh, non-compliance, there should be a rebuttal to that via doctor's notes. Like there should be evidence to the contrary, right? There should be evidence to the contrary. So I don't know if they've brought that up or not. Clearly, she had a lot of pharmacy, right? And you could certainly call this polypharmacy, right? Like the polypharmacy definition, it's just taking many medications at the same time, right? But I think it's not just the taking many medications at the same time, it's taking many medications that interact with one another at the same time and maybe have contradictory actions and stuff like that. So she's got bipolar, or she now has a diagnosis of bipolar, correct? She was diagnosed with bipolar. Was it 1 or 2? After the fact. So, forensic psychiatrist Resnick testified as the final witness. He revealed the formal retrospective diagnosis was bipolar 2 with postpartum onset. Okay. Distinction between bipolar 1 and bipolar 2. Hypomania versus mania. Bipolar 1 requires full manic. Bipolar 2 involves severe depressive with milder manic. So she's got bipolar 2. Yeah, I mean, look, man, irrespective of everything that's happened, like, it is pretty crazy and, like, irresponsible of the medical system to do this, right? It's pretty barbaric to be on these types of medications. And I think this is a bigger problem in what is it? Just medicine in general, in that, like, we don't have any other options. Right. We don't have any other options. We don't use anything else. There is no other solution to any of these things, to any of these problems. If someone fails an SSRI, what can we do? We give them another SSRI. If they fail that SSRI, what do? We give them an older class of antidepressant. What if they fail that? We go to an older class of antidepressant. What if they fail that? We go to a antipsychotic. What if they fail that? It just keeps going down this road. And it looks like she was going down that road, right? Of failing a lot of these medications. I've been on a lot of medications. I've failed a lot of medications. I've never been on several at the same time. That seems almost contradictory, right? So the side effects are not just like, I have numbness and itchy skin. They actually give you worsening suicidal ideation. They can worsen your psychosis. They can worsen mania. A lot of things can worsen outside of just some physical manifestations of side effects. A milder side effect of numbness, tingling, stomach cramps, whatever. So that is unfortunate. That is very unfortunate. I could see maybe the medical system felt like they were in a hard place and they're just like, we just got to try anything. We just got to try different things, and we just got to throw spaghetti at the wall and hope it sticks. But is that the best course of action? Probably not. It's hard to say, because that is a very difficult field. So she's been on a suicide hotline a couple times. She went to the ER. They said they couldn't admit her because she didn't have a plan. I don't understand that. I really don't. I've never worked at a psychiatric emergency room where we didn't take, like, suicidal ideation seriously. So, like, let's take a look at what exactly, or where she was going for that sort of help. Where was she going? Bro, no. Just summarize it. So she went to McLean Hospital and the emergency department at South Shore Hospital. The most intensive attempt to get help, January 1st, 2023, after confessing that she was having thoughts to harm herself and the children. She admitted herself to the psychiatric facility, stayed there for 5 days, discharged on January 5th. And remember what they did there? Let's take a look at what they did there. Here. Upon admitting herself, doctors evaluated her for sedation and order her off Seroquel and all benzodiazepines. So she went to the hospital for suicidal ideation and thoughts of harming herself and others. And what did they do? They gave her a drug detox. Do y'all think this was the right thing to do? Do y'all thought that was the right thing to do? If you were, give your non-medical expert opinion, do you all think it was appropriate to take someone with suicidal ideation and detox her for 5 days and then let her out on the street, back home, wherever? You know what I mean? No. What were they thinking, bro? What were they thinking? That is pretty bad. In my opinion, that's pretty bad. You went inpatient a few years ago. They kept you for 2 weeks while they changed medications. 5 days is insane. Yes. Letting her out was absolutely a mistake. She should have been there longer. Detox maybe from one medication to another. Yeah. All these are great ideas. Why aren't you guys practicing medicine? Why aren't you all the doctors there? Like, seriously, all of these are far better suggestions than what they did as medical professionals, right? Like, why? And you don't need a medical degree to know that this is a bad idea, dude. Like, this is awful. So she came off Seroquel and benzos in 5 days. And then what did they do right after that? Okay, let's look at what did they do right after that. They put her on Valium and right back to behavioral health meds. So I don't know, man. They were push-pulling. They were push-pulling way too fast. It was way too fast. Like that is a very fast push-pull. And for somebody having these symptoms, right? Harming self, children, someone having these symptoms and then having that kind of a push-pull is not good. In my opinion, not good. So why didn't they do that? Right? Why didn't they do that? Why didn't they help her at was it McLean or South McLean Hospital? Why did they detox for 5 days and discharge? Most heavily scrutinized elements. Great. Hospital did not keep her long because Clancy was a voluntary patient. Okay. Who actively denied having suicidal or homicidal thoughts. Wait, what? Testimony from her treating McLean psychiatrist, Dr. Goodhart. Wow, that's a cool name. Evidence presented by both the prosecution and defense outlines specific reason for a brief stay and subsequent discharge. Let's take a look. So they detoxed her. Profound emotional numbness, flat affect, severe insomnia, worsened by over medication and misdiagnosis strategy. Instead of keeping her on psychiatric holds, their primary clinical objective became tapering off of heavy set. Bro, if it's tapering, it should have been way longer than that, but okay. So it sounds like she wanted to go, but like they had no plan after the fact. I think, listen, right? No follow-up requirement. Exactly. You think you can just wash your hands of a patient just because they say, I don't want to do this anymore. I don't want to be here anymore. You still got to follow up. I feel like you still need to follow up, right? Like you still have to have them followed. And the fact that they said, okay, we did our job and let it go, that I don't think that sticks, man. Like, yeah, usually for serious things like this, it needs to be followed up. And then you should be held accountable. Like, you can't just let someone go and then something bad happens as a doctor. It usually comes back to you, right? Like it's coming back to them right now. No active plan. Dr. Goodhart testified that Clancy admitted to having a general suicidal thoughts in the past. Vehemently denied having active intent. Okay, great. Reasons to live. No threat to others. Desire to return home. After her medication was tapered down, she reported that her sleep had improved, expressing a strong desire to return home and to host a long birthday party for her daughter. She was voluntary. Yep, great. Safe environment. She was going to a safe environment, so they were okay with that. The discharge plan. I think this is what we needed. Discharge plan. Discharge her January 5th with prescriptions for milder sleep aid and anti-anxiety drugs, under the strict condition that she follow up with an outpatient mental health provider the very next day. Okay. The dueling arguments over the discharge. The defense stance. Her attorney, Kevin Reddington, argued that McLean failed Clancy. Yeah, I would say so. He established that the hospital never gathered her past outpatient records or spoke to her primary psychiatrist, which I've done this before, right? Like if I get a patient and they're followed closely by somebody either in my hospital system or somebody I can reach out to, I would be like, ring, ring, ring. Yo, we got your patient emergently in the emergency room. Like, here's what we're doing. Here's what we're going to discharge her with. What would you like? What do you want to do? Do you want to see her? Do you want, like, we would be contacting the actual provider. That's what should, like, sounds like they didn't do that, but okay. They didn't reach out to the psychiatrist. The clinicians misread her severe hollow dissociation as improvement, missing the underlying bipolar 2 and postpartum psychosis, right? And in 5 days, right? 5 days of tapering off a medication. How do you know what the person is telling you is rational at that point? That's a tough point, right? Because rationality is a purely subjective thing. And to me, it feels like rationality needs to have consistency, right? It needs to have consistency. So 5 days is not a lot of time to establish the rationality and consistency of it all. So that's probably why they missed a diagnosis, or can very easily miss a diagnosis, especially bipolar and postpartum psychosis that was actively developing. The prosecution stance. Prosecutors used the McLean state to argue that Clancy was entirely lucid, clear-minded, and calculating. They argued that she purposely downplayed her systems to doctors so she could be released early, proving she was capable of rational thought. Bro, not a single person maybe a single person in the psych ward wants to be there. Like, that's not the strange part, right? Everybody in the hospital wants to leave the hospital. Everybody wants to leave. But the right time to leave is determined by the doctor. Always. And then if you say, I want to leave still, then you go against medical advice and you sign paperwork saying, I said this is not the right time for you to leave the hospital. And they either sign it or they don't. But at least you have a signed document saying this was not the right time to leave the hospital, right? Like you say, like this was inappropriate AMA against medical advice. So I don't think that is evidence that she was lucid, clear-minding, and calculating. They are stepping from point A to Z in a crazy fashion. Like that is a stretch, man. That is a stretch, right? Like that can't allude to lucidity. Absolutely not. Because guess what? I had people believing they were God and they said, I don't need to be here. I need to leave. I need to leave this psychiatric ward. I shouldn't be here. But they also think they're God, so they shouldn't leave. Right? I don't need to be here. Just because they want to leave doesn't mean they're lucid. So I've heard a lot of like, okay, maybe the father, the husband, has a part in it. Let's look at how this can be construed, right? Where does this come into play? How does this actually play into the trial? Because like it's one thing to have a psychotic event and, you know, an outcome, a morbid outcome like this. It's another thing when there's another person, right? In this case, the husband. So what is the primary argument that the husband has a role in this chat? What is like, why is he being, I don't know, accused? Why is he being dragged into it? I don't know this part of it. So I need you guys' help to, I guess, figure this out. So how she was found, whether she actually would remember if she did it or not, or whether her husband told her she did this and she accepted it. So is that the primary, I guess, or the leading hypothesis, right? Is that the leading hypothesis? Is that perhaps the husband actually was the culprit, and you have a wife in this case, with some behavioral mental plasticity of like, you know, she can be told this and she'll believe it. Like, is that it? Or was it that he knew, as you are alluding to, you guys, that she told him a lot of these issues and he went ahead and left anyway, right? And something about her body temperature. I'm not quite sure how that plays into it. Anybody want to like jump in the call and like kind of talk through it with me, like explain it to me? And anybody available to do that? Because like I don't know. I don't know this part of it, I guess.